My name is Jason O'Brien, and I'm the primary lead for Listening Ear. This is our three-part video series about the encounter and handing off. Welcome to Video 3, Conducting the Handoff and Escort. There are three key elements to this. Number one, we need to recognize why we hand off and what issues should be handed off. Second will be the station chief's role in this process. And third, the procedures and considerations for handing off and escorting. In identifying when to hand off, we need to explain why we hand off. The primary reason would be that listening ear is not equipped for the severity of the situation that the participant is encountering. The longer we delay, the more the situation could deteriorate. We want the most appropriate care for the participant as soon as possible. One of the obvious handoff topics is physical injury. The participant needs medical attention. LE should escort that participant to the nearest medical center. If necessary, listening ear can call for a vehicle transport. There will be a phone number provided for all Jamboree emergencies. Emotional injury. This is where the participant is emotionally hurt and in significant discomfort. As we talked about in video 2, this is something more serious and more complex than would be easily handled in a brief encounter. Perhaps the person cannot stop crying or is having trouble to maintain their own sense of self-control. It may seem that talking only makes it worse for them. If their body is in panic mode, they may have trouble catching their breath, and they may also report that their heartbeat is excessively fast or hard. In other words, they're having a very difficult time relaxing. If someone is threatening to hurt themselves or others, this is an automatic referral to Tier 2. You want to use your own sense of worry and fear to help assess the need for a handoff. If they seem to be hurting more than you can handle, then Tier 2 is probably the best place for them to go. If it seems that you can't help just by listening, and if you find that you're getting upset by their circumstances, all of these indicate a greater need for services. If we have a serious violation of the code of conduct, we need to go ahead and move that participant to Tier 2 services. Even if we don't hear directly, but maybe we seriously suspect that a code of conduct or something illegal has occurred, it is our job to refer it to Tier 2. It is not Listening Ear's job in 2019 to investigate. The station chiefs have a vital role when it comes to the handoff and escort. They supervise the entire process. The station chief determines the proper manner for the handoff to occur. They will establish which listening ear staff should accompany the participant in need. We would want to consider the participant's wishes if possible. Does the base camp mental health have someone who speaks the participant's language? If we have someone in listening ear that speaks the language, we would definitely want them to accompany the participant to Tier 2. And 2 deep leadership can be maintained by one LE staff and any second responsible adult. So if the participant has an adult with them, maybe from their contingent, that could serve as the second person in 2 deep leadership. But we do prefer to maintain LE pairs if possible. An additional role for the station chief is to determine the preferred manner to engage Tier 2. The preferred initial method will be a walking escort, making sure we maintain 2 deep coverage to the base camp mental health location. It is the station chief's job to contact the base camp mental health liaison officer ahead of their arrival. We can call for physical transport where the station chief would request a vehicle because of the nature of the situation. Or in the most severe cases, we can request that the base camp mental health liaison come to the listening ear station or the location of the participant to help them be transported. Procedures and considerations for the handoff and escort. The station chief is informed that a handoff is needed. All information is entered into the encounter form. The station chief contacts the base camp mental health liaison officer and indicates the preferred escort method. Every effort is made to keep the participant comfortable, and a choice of LE staff of who could accompany them should be considered. Confidentiality is maintained. If we are escorting by walking, the staff member should be discreet. Please respect the individual's wishes. Remember that 2-deep leadership means that the second observer must be able to fully observe and be able to respond should the situation require. It would be okay, however, to be 4 or 5 steps behind the escorting LE person and participant. In the event of vehicle transportation, at least one LE staff member will ride along to escort the participant to the base camp mental health location. The encounter form needs to document who receives the participant at base camp mental health. Make sure you get their registration number. We will be keeping the encounter form, but there will be copying facilities available so that the Tier 2 individual can also have a copy of the encounter information. This brings us to a close of video 3. I want to thank you for your attention and your time in learning all of the important information that has been presented. I am sure this does not answer all questions that you may have. So please contact your station chief with any questions or concerns about the training you've received.